Rama Masiho, who is the site leader at Mulago National Referral Hospital, Musiho, sorry, who is the site leader at Mulago National Referral Hospital, to understand where does the problem comes from. But before we go in there, producer is going to give us that video that we may understand what transpired yesterday in the presser they heard.
The president directed that medical interns shall be paid half of the recommended salary of fully appointed officers as per the public service structure. And if you look at half by the time of the directive, the fully appointed officers in this context, you have the medical officers, you have the pharmacists, you have the dental surgeons, you have the nurses and midwives. So as an example, the doctors, by the time of the directive, it was 5 million, and it has been 2.5 million gross pay. And this is what has been breached. So on 1st of February, all medical interns in the country will lay down tools because of failure of government to respond to the breach in this presidential directive, and all our efforts that have been made in the past and that had gone into waste are not responded to.
There is not enough money to pay the earlier directive, and even the revising to 1 million net. It was in consultation with the president who had issued the earlier. They needed to do is to concentrate and finish their internship and pave way for a new cohort of interns who have been waiting home. There were many months when they were not in hospitals, and the hospitals were running because we have staff.
I am the LOC1 chairman at the moment.
Dr. Rama.
Yes.
This camera is yours, and we want to understand where the real problem comes from. Please just break it to us and the viewers from the genesis of the issue and where we are now. That's your camera. You have the camera.
So, my name is Dr. Musiho Ramadan. I would like to say good morning to all our viewers, and I would like to say it's a good occasion. It's always a pleasure to be here with Bethany TV.
Yes, sir.
Last time I was here, we were talking about intense issues. However, that time we hadn't yet been deployed, we were still pre-interns, and the struggle was still ongoing, and we were requesting government to deploy us. And we were also saying, that was last year in 2023, between I think about March to August when we were deployed, there was a very long period of not having medical interns in hospitals, and then we're having the struggles here and there of trying to make sure that government understands that medical interns are actually necessary, and the fact that there is a human resource gap in the medical field at the moment in the public organization of health delivery services in the country, which needed to be filled by the fact that the previous cohort of medical interns had finished, and therefore we're having a new cohort of medical interns that needed to now go on with their internship, one for their own progress of their careers, and also for the sake of the government of Uganda, since the public also needs to get that health service that we give. However, the problem rooted from way back, I think it was a problem in planning. Ministry of Health had always been complaining of the figures and the numbers of medical interns that were coming in every year. This is because we have increased numbers of medical schools, which I would say is a good thing, because the doctor-patient ratio is really not the best as compared to what is...
One doctor handling something like 25,000.
Yeah, 25,000 of the population.
Which is quite contrary to the World Health Organization.
Contrary to the World Health Organization.
Exactly, they have one doctor to something like 2,000
Yeah,
patients.
that they think that should be the optimum for a developing country.
Sorry, cut you short, but that was last weekend.
Yes.
The NAM heads of states we had here and the leaders, their spouses and other government officials toured Mulago Women
Women's and Hospital.
And I heard Dr. Evelyn Nabunya, who is executive director, saying that we are down with human resource.
True.
Standing at 36.6%. We need human resource. When go to government hospitals, go to Eastern Uganda, there are no people to work in there. I mean, government nurses and everything. So I thought they would be excited that there is an influx of medical interns. But it's the opposite, I think, now.
Yes, opposite.
Please go right ahead.
So I was trying to still explain the fact that this gap has happened, And you see, it's a funny thing to have departments of planning, because I know the Ministry of Health has a complete department. I think there's even a commissioner specifically for planning. The Ministry of Finance also has that too. And all these government agencies, they do be able to plan. So Ministry of Finance, Ministry of Health, Ministry of Education, that is educating these doctors, they should be able to come together and then make an understanding. They should be able to track the numbers. Then they should be able also to know the financial implication and then make sure that they pay the money that the medical interns deserve to receive. Because these medical interns are graduates. They deserve to receive salaries. And these salaries are the ones that are supposed to push them and make sure that they are motivated to do their work. They do up to 60 to 70% of the health service delivery in hospitals. This is something that is pertinent, but to a layman out there, they cannot understand that we're actually saving government a lot of money. Because if government, from those figures that you have told us, about 32.1% coverage, the remaining coverage is usually covered by medical interns. Why? Medical interns are being paid as opposed to be paid at least half of what their senior cadres are getting. So if you pay medical interns half the senior cadres' salary, then the medical interns are going to go on to do the work that you would need to employ somebody whom you would have to pay double. So this is saving government a lot of money by deploying these medical interns. However, they have remained adamant. They have remained adamant to these issues, and it has not been nice. So we went through that struggle last year about deployment of medical interns. There were so many scuffles with police. There were so many confrontations between medical pre-interns at the time with government officials on social media, even actively, even in person. There were even times when we reached Ministry of Health and told them, please, you need to deploy us. However, something that happened that wasn't right was that they deployed us, but they did something illegal. Mm-hmm. They sat down, and then I don't know where they defined the statutory instrument, and then they deployed interns with the 1 million as basic salary. And they actually didn't give it us. They said that this is supposed to cater for accommodation and feeding. This is reducing the welfare of a medical intern to just feeding and accommodation. A medical intern needs more than that. They're supposed to dress well. They're supposed to have their medical gowns. They're supposed to have a stethoscope, a BP machine. They're supposed to have all these equipments available. They're supposed to have family members that they're taking care of. They have basic needs, other things. Okay, it's okay. Let's understand that somebody has got accommodation and feeding. How about their dressing? How about their transport? These are things that we should look into. And you see, it is very easy to pick money from medical interns. You reduce medical interns' wages by 40%. But we have also tried to tell people out there that really if we reduced the figures or the allowances, maybe the salaries, the wages of other government officials, what would be the response? We have tried, we have asked these questions. We asked the Minister, Honorable General Thacheng, if 100,000 was put off your salary, what would you say? And I don't think they are ready to accept that. So the genesis of the problem right now is that when we were deployed in August of last year, towards 3rd August specifically, the document from Ministry of Health, the presser, said that now we are going to receive 1 million for accommodation and feeding. However, previously there was a presidential directive that was in 2021, I think around 17th of July of 2021, a decision had been made which included ministry officials, the Federation of Uganda Medical Interns leaders by the time, UMA leaders, and in general, also opinion leaders in the medical fraternity. So they sat down with the president, then they came down to a figure and said that it would be worth it to give a medical intern half the pay that a senior cadre who has been contracted by government is getting. So therefore, by saying half, it means medical interns where we have doctors, pharmacists, dentists, nurses, and midwives, they're supposed to get half. What does that mean? It means that by the time when this came out, doctors who are working in the government public service structure are getting 5 million. That means the medical intern who is a doctor is supposed to be getting 2.5 million gross pay. And then when you trickle down to the net pay, it should be about 1.83 million. We were comfortable there. And this, I would tell you, is something that would motivate us to make sure that we ensure that we give dedicated service to all the Ugandans out there. The problem that comes is that many of the time, these people who make these decisions are people who are well off. They can actually go out, they can fly out of the country and get medical care. They can actually go to Nairobi. They can actually also try and get private health care in the private facilities we have in Uganda, like maybe IHK, like Nakasero. However, a Ugandan down there, maybe a mother who who needs to have a delivery, who has got an emergency in one of our health facilities, will have to be rushed to Kawempe. And when they reach Kawempe, they are going to find a medical intern as the first person who's going to receive them in the hospital.
Dr. Rama, the Ugandan who's watching there want to understand deeply, what do medical interns do in the hospitals?
So what medical interns do in the hospitals is that they provide the full services that are supposed to actually be given by the senior cadres who are in these positions.
For instance?
Government employees, doctors, dentists, pharmacists, nurses and midwives.
Okay.
However, government has been unable to fulfill all the positions that are supposed to be covered in the public service structure. For example, let me say we have a district hospital. It's supposed to be having at least maybe 5 doctors. It's supposed to be having at least 2 dental surgeons. It's supposed to be having at least maybe say 3 pharmacists. And then maybe it's supposed to have graduate nurses, up to let me say 10 of them. And then midwives, let me say 5. So what the government has been doing is that it has been having 40% coverage. That means it has been having way less coverage. It has maybe, if there was supposed to be 5 doctors, it has 2. If it's supposed to be 10 midwives, it's having 3.
So who covers that gap?
So who covers that gap is now the medical interns. What the government has done as their plan to cut costs is they get the medical interns who are just fresh out of university, they've just graduated. They need medical internship in order to get licensure. It's a legal path that's supposed to take, so that they get licensure to work in the country. They use them at a lesser pay, and these cover the gap that is there in the medical.
Please make it clear.
Yes.
What's the qualification of a medical intern? What level are they? Are they?
A medical intern is at the level of the senior cadre. Why are they at the level of senior cadre? They are actually graduates. These are people who have graduated from medical school. They have completed their training. However, the government needs to undersee. They need to undertake a process of supervision, a supervisory process whereby they are watched by their seniors to make sure that the training they have gone through is actually adequate enough for them to be trusted to work on their own. So basically, it is like I've already used that example. By the time you go to the driver's license school, you know that process. You go to the IOV, and then before you get the driver's license, you go and get a learner's permit. Then you've gone through a driving school, and then you go to the IOV, and then the IOV tests you. By the time you go to the IOV, you have already know how to drive.
So you've been driving?
You know how to drive. You've been driving. And many a time, people have actually been driving on our roads.
Actually, for something like 5-10 years.
Yeah, people have actually been driving for so long. What we know in the country is that up to 40% of the people on roads right now don't even have driving permits.
So that means that medical interns are not trial and error persons.
They actually know what they are doing. And that is why most of the time they are doing this work without even supervision. The supervisor comes in to just guide in difficult situations. But most of the time, the medical intern is doing most of the work. They're doing 60% of the work. If I should tell you something, actually when the medical interns are deployed and they come and work, they are actually supervised for I think the first 1 or 2 weeks. Most of the time, first 1 or 2 weeks, and then the seniors, they lie back, and then they let the medical interns do most of the work.
And work moves as if
work moves smoothly.
Work
moves smoothly. I should tell you that it's not often that medical interns are doing work and work is not moving smoothly. All I have to do is I have to do all the work I'm supposed to do. And when I have an issue, I call my boss. I ask him, I've had a situation. This is a difficult one. Could you come in and help?
Okay, please help me understand, and the viewers out there, what don't we know and what do we know concerning medical interns? Or what do we think we don't understand?
What we don't understand is there's some issues. Medical intern is a derogatory word. It shouldn't be the title that is given to medical interns. Why? Because most of the interns out there, these are I'm giving basically. As a journalist, you should know this. As a journalist, when you are a journalist intern, you're actually not graduated. You're still studying journalism.
That's it.
So when you study journalism, you're going to come to Bethany TV. You're going to get an internship placement, and then you're going to come here and practice journalism as a student. So you're still studying. So you're not employed. But still, something nice about this organization is that Bethany TV will give you an allowance. For the work you're doing, because as you're doing your internship, they're still giving you something. So it's acceptable and it's nice always, and that's why you see that interns will always look for those places where they're getting something, an allowance, because it motivates them to do more work. However, for medical interns, that's why I'm saying interns is a derogatory word, is because they are graduates. They're actually called doctors, they are called pharmacists, they are called nurses, they are called midwives, they are called dentists. However, they are going through a process. process of legalizing
to be
them.
called?
So I have thought of a title to be called. However, it's being used elsewhere.
Okay.
Like in the UK, you can say we could actually be called junior doctors, junior pharmacists, because the other name we actually called in hospital is junior health officers. Yes, junior health officers. However, if you say intern, every person, the public has always been mistaking it for students. Whenever they see interns say something, they always say, medical students, what are they saying? They don't differentiate between medical interns and students. And they're saying, where are students being paid? No, these are medical interns, these are graduates. These are not students. And we have really tried to make sure that people understand this, but they haven't done so. I think we should actually now go into a process whereby we actually change the name from medical interns to at least junior medical officer, junior dentist, junior midwife, junior.
Have you resorted, you yourselves, take a first initiative to change that name?
We haven't taken an initiative to change the name. What you're actually focusing on is the bigger picture. Is now, if we try and fight the small wars, we are going to miss out on the bigger war. The bigger war is the one of welfare, and that's why it's the one that is the forefront right now. The issue of welfare has brought a lot of issues. You know, we have medical interns who are having mental health troubles. If you pay a medical intern the amount of money that's supposed to be paid, now you can bring up all the rules that you've brought up. Medical interns are not allowed to have side business. They're not allowed to have side jobs. They're not allowed to miss work. They're supposed to work 24/7. They actually get, I think, 1 free day a week.
So, Dr. Rama, what is that?
What we have there is the breakdown of the different cadres. We have the medical doctors. Our bosses are getting 5.4 million.
Okay.
So when you break it down to half, it becomes 2.7 million. Okay. So this is a breakdown of how much each of the cadres of the medical interns are supposed to get. Okay. So these are a medical intern doctor, 2.7. A medical intern pharmacist, their boss is getting 2.4, 5.4 gross pay. They should also be getting 2.7 million gross pay. The intern midwives and intern nurses, their bosses are getting 4.4 million. They should be getting 2.2 million gross. The dental are getting 5.4. The medical intern the medical intern dentist should be getting 2.7 million.
So who's suggesting this? Are you the one suggesting this?
We're not the one suggesting this. This the presidential directive came out. It's a legal document. It's a statutory instrument by government that legalizes the fact that you're supposed to be paid
President
this amount of money.
Releases this?
President Museveni actually released this.
Without the consent of the Minister of Health?
No. President Museveni released this in 2021. It was actually paid. The interns by then, that is the interns in 2021 cohort, they started receiving this money. They were the first lot to receive this money. Then the interns before us, the interns of 2022 to 2023, also received this money, the whole pay of the whole period of time. So, however, when we were deployed, they changed it. This is very illegal, by the way. There is no document that has come out officially by the president changing this amount of money.
To alter this. So did the Minister of Health consent with this?
The Minister of Health consented because the document that deployed us comes from the Director General of Health Services. The Director General of Health Services, Dr. Henry Mwebesa is actually the head of the National Internship Committee, who works hand in hand with his permanent secretary and also his minister. We have engaged him on very many occasions. There have been confrontations. There have been those that have been very vocal, those that have been very... He's actually somebody that you can reach off WhatsApp. You can actually give him a call and he actually picks up. So we have engaged him. So we have talked to him.
What's his
mind? The reason why we are here actually is because we have reached an impasse.
What do you mean by an impasse?
By an impasse, I mean that we have found a roadblock. We have talked to all avenues. We have gone through, we don't know the extent we have reached trying to make this people understand that, hey, there's a problem and this problem needs to be sorted.
Does Dr. Mwebesa understand where you're coming from?
Yes, Dr. Mwebesa understands where we're coming from. He's actually somebody I respect so much in the medical fraternity. He understands where we're coming from. He actually knows the genesis of this problem very well. He's one of the people who know the genesis of this problem very well. However, they have remained adamant to solve these problems. Why are you not? These are people who have access to the decision-making offices. They have access to the political pockets. They're supposed to be the ones who are actually saying, no, that the medical intern receive the money that's supposed to receive. He knows the amount of work we do. He knows what it means when we are missing. He actually gets the figures. He gets the figures of how many mothers are actually bleeding to death, how many kids are you actually losing, how many patients are you actually losing when you don't have medical interns. He actually gets those pictures.
For those who are joining us, I'm joined by Dr. Rama Musiho, and he's the site leader at Mulago National Referral Hospital. He's a junior doctor and he's been behind this, and they're saying that we need the presidential directive to stay standing. We don't need any alteration, because apparently there's been some alteration. So that's why they're threatening a strike to come by 1st of February, if I'm not mistaken. So we're going to take a break. When we come back, we're going to dig deep. And one of the people that I want to engage Dr. Rama with will be the Permanent Secretary of the Ministry of Health, Dr. Dana Twini, who has really had the similar incidents that they are grappling with, and we'll be talking more when we come back.
Focus. Focus on Healthy Morning. Bethany TV for Health. Showing on Bethany TV.
Why do we get sick?
That lack of knowledge is it's a very, very big problem.
What can we do to avoid becoming sick?
From hospital and you're fine, you don't disappear. Come back after 6 days. We do an assessment. How is your blood pressure? How are you doing? How are you coping up with motherhood?
Here's an opportunity to learn about some of the common illnesses and how to avoid them.
Don't overuse your knee joint.
Buli muntu yenna alina obulwadde obwa diabetes, obwa pressure, yetaaga eye check-up.
Get all your health questions answered by a health expert.
Only on the new series of Health and Wellness. Every Saturday, 8 p.m. live on Bethany TV with your host, Dorothy Ainembabazi. Are you looking for a platform to advertise your business and boost your sales? Bethany TV got you covered. Take advantage of our introductory rates and maximize your leverage for brand awareness, advertising, product launching, live coverages, activations, and so much more. For booking and more information, contact our sales team on 0785 576 269. Bethany TV for Health. Exciting news for all viewers of Bethany TV. Bethany TV, the premier health TV channel in Uganda and Africa, and also your favorite TV station, is now on Star Times. You can now watch Bethany TV day and night, weekdays and weekends on Star Times, channel 271. Catch your favorite programs on health, wellness, entertainment, and so much more. Bethany TV is also available on free-to-air, GoTV, YoTV, Airtel TV, and Afro mobile apps. Not forgetting online via our website www.bethanytv.ug and social media platforms at Bethany TV UG. Bethany TV for Health. Showing on Bethany TV. Life-threatening experiences. More lives on the line. Rekindling the past. Saving lives in spectacular fashions. Chicago Med, Season 8. Monday to Wednesday, 9 a.m. to 10 a.m. Repeats, Tuesday, Wednesday, and Thursday, 11 a.m.
Health Minutes on Bethany TV.
Breakfast is the first meal of the day, usually eaten in the morning. Having a healthy breakfast is important because it replenishes your supply of glucose to boost your energy levels and alertness.
Reasons as to why you should have a healthy breakfast. It helps in having good cognition of the mind. You have good mood for that day,
while also providing other essential nutrients required for good health. These are some of the foods that a healthy breakfast consists of:
a protein, a fiber, and then a healthy fat. Not all fat is healthy. The protein, you can eat an egg. It is a good protein to eat. Then for the fiber, you can have something like a fruit or vegetables. Briefly, that is what is entailed in a healthy breakfast.
Better healthcare for a better tomorrow. That was the Health Minute.
Bethany TV for health. Focus. Focus on Healthy Morning.
Good morning. Thanks for joining us once again. Joined by Dr. Rama Mosiho, who is the site officer at Mulago National Hospital. He's a junior doctor in there, and they're threatening to stage a strike come 1st February. And that's not very far away from here. It is actually the next week from now. If not, could be on Wednesday. Will this strike stand or not? Now, of course, the problem is rising from salary discrepancies and disparities, and they're like, something must be done, especially the presidential directive which was issued in 2021. We need the salaries, but the Minister of Health is saying that we are short of money. We cannot do this. Like I said, over the weekend when we saw the NAM delegates who toured Mulago Women and Neonatal Specialized Hospital, Dr. Evelyn Nabunya, who is the executive director, said that actually we are short of human resource at 36.6%, which is really, really down. But also when you look at the World Health Organization report on doctor to patient ratio, states that 1 doctor to 2,000 patients, but it's quite contrary to what's happening in Uganda, where 1 doctor is treating 25,000, apparently, which is too high. But how can we forget the Abuja Declaration in 2000 in Abuja, Nigeria, which called for African states to allocate 15% of their annual budget to the ministries of health in order to alleviate their increasing simmering challenges that are tearing apart and grappling or suffocating the health ministry. Now today, the doctor is in the house, and we are casting more light where the problem really emanates from. Will the strike mitigate these challenges that are coming, or it won't? Will President come in? What is the solution, and how can we go about it? It should be noted that in 2016, when President Museveni appoints Dr. Diana Twine as the permanent secretary, all the permanent secretaries were earning 3 million shillings as the salary. But of course, then Dr. Diana Twine comes from State House, comes to be permanent secretary. That was really little money. And guess what? What we saw was the permanent secretary, P of public service, to increase the salaries from 3 million to 15.4 million shillings. Of course, this raised eyebrows from the judges. They're like, how can you triple this salary? No, we can't accept this. But that's what happened. So we are thinking maybe the savior would come from somewhere and salvage the medical interns, and the issue is solved once and for all. Dr. Rama, yes. Have you engaged Dr. Diana Twine? She has ever been... We have
engaged Dr. Diana on so many fronts.
And what's her response? She's the permanent secretary.
Her response sometimes is great. That's when she's talking directly to us, but it seems like her response when we're not there is not so great. It seems like she doesn't appreciate what medical interns are doing for the country, and it seems like she's one of the people who are pushing for medical interns to even get less money. If you remember, when we were still in the pre-internship struggles and were trying to get deployed, Dr. Diana Twine had a Zoom meeting with the pre-interns, an illegal Zoom meeting, and then communicated to the interns that, look, we are releasing a Google form. You're about 1,900. However, we want to get among you the rich and those who can afford to cater for their accommodation and feeding, so that they come out of the money, and then for them they can go get deployed, do their medical internship, and then they get on with life. Maybe most likely, of course, they'll still get them government jobs, they'll still give them offices in the Ministry of Health and go on with such work. So this is something we should note, that if we should be given a position like the permanent secretary of the Ministry of Health, there should be people who put the welfare of medical interns forward. How there's a person who says she's a mother of us, of the medical interns, of the junior doctors, the junior nurses, but then wakes up one day, comes and tells medical interns blatantly that, okay, look, we don't have money. What you are going to do is you're going to choose among you who can work for free, who are actually rich enough to actually pay their own salary, and then they can go and then do this work. The work of a medical intern is so much, you cannot reduce it down to just food and accommodation. And you cannot also go and then put lines of divisionism and put hierarchy of society depending on issues of how much money can someone actually have, can pull over. And actually the excuse was that parents had actually approached her And I would like to say that this is a lie. This is not something that is true. We actually approached her on so many occasions, and our request was always, why can't you reach out to your connections and make sure that you pull the strings in government to make sure that the salaries of medical interns are actually paid?
Dr. Rama, olumungena nendowooza nti oba baba wabyo byanswa kubanga New Vision ennaku z'omwezi January w'ennaku z'omwezi 2017 yawandiika ebigambo bino in a circular dated January 12th, 2017 to all permanent secretaries. Now this was Catherine Bitarakwat was permanent secretary, announced that from effective January 1st, the salary of Chief Justice will be increased from 11.5 million to 20 million per month. His deputy from 10.5 to 18. Head of Public Service from 4.9 million to 17.6. And the deputy. And permanent secretaries from 3.7 to 15.4. Has the public service, have we seen twali tufunyeko ku kiwandiiko bwe kiti oba just twawulira presidential directive kyeŋŋambye nti oba baba wabyo ebyanswa kubanga kino okuva we kyayisibwa tekikyukanga paka kati.
So what actually happened is
yogera mu Luganda waliwo baganda bafa
bayinza okwetaba okuwulira ku ddoboozi y'Oluganda batufune bulungi. Kati ku nsonga ya medical intern ekyaliwo kiri nti ba medical intern bali under Ministry of Health. That's why ebiseera ebisinga we tuba tuyomba Ministry of Health tedikola mulimu gwayo okubeera nga ekwasaganya ki okubeera nga obwa intern ba intern bano abali under Ministry of Health. Ministry of Health teri mu kufaayo abasawo bano abali mu kugezesebwa abali kuyita mu kugezesebwa. Ministry of Health teri mu kufaayo eri abakozi baayo because okubeera nga tuli under Ministry of Health fe emisala gyaffe tegiyita eri mu public service. Kyalinga bwe kityo mu biseera ebikadde nti bamwebesa badayana ate ne bakolera intern bayitanga mu public service babeeranga mu public service on probation naye banga emisala gyabwe gyajjanga ku budde era nga emisala we gyayongezebwanga ate tegyakwatibwangako. However, bakayitanga kalombolombo okugeziwala ne bagamba aba medical intern kati bajja mu public service kati bateeke under Ministry of Health. Emisala gyabwe gibeere nga giyita Ministry of Health gibeere nga gisobola okubeera nga gizanyirwako. We giba under Ministry of Health, President n'ayisa directive nti zino za allowance kazijje nga ziri obukadde 2.5 gross pay. Omuntu asobola okera kumanja ku Ministry of Health n'asalawo n'agamba nti bano abakulu kambakendeze sente era bwe kyali omwaka oguwedde n'azikendeza okuva ku 2.5 n'aziza ku kakadde kamu ate ne wabanga tewali amugambako. Okiraba ate tulina n'endowooza nti wayinza okubaawo okubeera nga waliwo ababulankanya ku ssente ku Ministry of Health eyo yennyini okubeera nga ezo ssente zituuka nga ziri obukadde 2.5 naye ate wezimala okutuuka obukadde 2.5 engeri ekiri nti tuli under Ministry of Health ne bazikwata ne bazikendezaako ne batuwa akakadde kamu ezigali ne baziba nga bazikozesa ebirala okubeera nga bazibulankanya. Naye lumu amazima gagenda okubeera nga gavaayo okubeera nga gatubulira ekituufu nti kiddala ekigenda mu maaso ku Ministry of Health ekituufu ekigenda mu maaso kigenda kubeera nga kivaayo nga kizuuka. Wayogeddeko ku nsonga y'okubeera nga Diana Atwine yagenda okubeera nga aweebwa permanent secretary sente ne zeeyongera okuva bukadde 3 kutuuka ku bukadde 15 nga nno tewali nnyo nno nsonga eri awo nti nno bakedde ku makya ne bayita mu parliament ekiragiro kyayita buyita. Kati nno mbadde nsaba bambi singa bali ku medical intern oba tufuneyo okuba ne ba planned kids nga bwe tugamba ba Diana Atwine nabo nga ba medical intern osanga ye banatuwa ku mukisa n'olabanga medical intern sente zaabwe nazo zikoze eki zirinnye kubanga onoomu naye yafuuse medical intern. Kya buswavu nnyo. Part of the plan gye twali tusabye nti aba medical intern bano engeri ki nti baliko mu public service officially employed on probation by government babeere nga babazaayo mu public service. Bambi tusiima akasente kaabo abali contracted by public service mu government ya Uganda omusala gwabwe gukola ki gutuukira mu budde. However, aba medical intern babadde ka Ministry of Health omusala gwabwe tebagenda kufuna buli mwezi tugulinira emyezi 3 4 5 sente okubeera nga zijja wenjogerera kati omusala ogwa January teguna kubeera nga gutuuka naye nga January mumumanyi January alimu school fees January alimu okuza abaana ku ssomero January alimu kale obwavu economy etuuka neefuuka nga nzibu nnyo saturation sente ziba ntono mu saturation naye ate weewuunye government omusala gwa January tena kubeera nga ekola ki egusindika naye nga medical intern abadde nga akola mu Christmas abadde akola mu kuyingira omwaka abadde akola abantu bali mu kwokya biriro yali mu kukola mu kiro ku emergency ali mu kukola abatamidde simanyi biki abafunye obubenje mu obudde bonna ye medical intern ali mu kukola ki ali mu kukola kaddaaki webale kubeera nga oleeta ki oleeta ebbaluwa producer kubanga lwaki twatudde wansi ne tugamba nti nga ba medical intern mu ggwanga lyonna mu association etugatta gye tuyita Federation of Uganda Medical Intern eri mu mateeka okubeera nga etwala welfare z'aba intern okubeera nga yezipushingira okubeera nga esindika okubeera nga kituukirwako nti basasulwa sente zebalina okubeera nga basasulwa.
Yes.
Batudde wansi n'abakulembeze waffe president waffe Bill Adrati ba vice president Fumi nga nange mwendi nga site tulide wa Mulago National Referral Hospital medical intern ne balonda ne basalawo nti sente ze tulina okusasulwa zimanyikiddwa presidential directive weegi okuddako nga president yennyini azzeemu n'awandiika ekiwandiiko ekigamba nti sente zikendeezebwe. Tugambe tugenda kussa wansi ebikolwa mu bikolwa ntegeeza tugenda kujjamu giraavu zetubadde twambadde ne tuba nga tuexamininga abalwadde ne tubakuba obuyiso bwonna tugenda buteeka wansi tugenda kuteeka wansi stethoscope tugenda kuteeka wansi ebirongoosa tugenda kuteeka wansi buli kimu paka nga zino sente zikoze zitya ziziddwayo ku sente zirina okubeera nga zisasulwa ate tubeere nga tusasulwa sente zonna zitubanja wakati bazze batubba okuva omwaka ogwedde batudeployinga mu August batuwa kakadde kamu naye nga tulina okufuna obukadde 2.5 kiba kitegeeza bambi tugenda kuteeka wansi ebikolwa paka olunaku ekisooka okubeera nga basasula sente zo zonna okuva gye zaatandikira paka bwe tugenda kumalirako intern ekyokubiri okujjako nga bavudde mu bulambukulufu ne bagamba mu mateeka kyekino ekyasalwawo era ekukyusa kuno kwavamu n'ofiisi ne meeting ne minutes eza meeting eyatuulibwa okubeera nga kisalibwawo okubeera nga kikyusibwa nga egize nekola ki nekivaayo gye tuli. However, standing orders eziriwo ziri nti PO/03 eyaliwo mu 9 August 2021 erina okubeera nga gye tugenderako. Okukyusa ekyo ekintu kyonna kirina kubeera nga kijira mu mateeka. Era tulirode okubeera nga tukola ebintu byonna mu buno obudde tugenda kubeera nga tutuula wansi tugenda kusigala nga tugenda mu kooti tugenda kusigala nga twogerera eri bannamawulire tugenda kwogerera eri abantu abawansi paka ng'ensonga ekoki ekoleddwako. Era omuntu yenna alina eddoboozi eryo erisobola okubeera nga lyambako ba medical intern oba abasawo bano abali mu kutendekebwa abasawo abato omuntu yenna alina eddoboozi okubeera nga asobola okwongerako kweno ensonga y'okubeera nga tebasasulwa bulungi tebasasulwa musolo gwabwe tebasasula sente zaabwe ze balina kubeera nga bafuna abeere nga ajayiye eddoboozi abeere nga alyogera paka nga liwulikiddwa oyo alina okubeera nga aliwulira sente zaabwe zibeere nga zivaayo.
Twogera kuba intern ki bano abaliwo oba abajja era bali bameka?
Kati tuli mu kwogera kuba intern okuva leero abaliwo kati bali mu kukola abo abakyali ewaka ne bali ba medical student abakyali mu kusoma nti sente zino ba medical intern sifefekka nze okubeera wano eno siri mu kubeera nti njagala okubeera nti nina omulugube njagala kubeera nga nfuna nnyo ssente mu mulembe gwange tugambye nti ba medical intern okutandikira ku mulembe guno nga abatuyitako bano abamaze last year ba medical intern kuba bafuna sente zaabwe okutandikirako ffe bambi batusasule abalijja nabo basasule.
Mulinga bameka?
Tuli ba medical intern 1926 abadeployingibwa. Yes.
Mwadeployingibwa mwaka ki?
Twadeployingibwa last year mu August.
Mu August kitegeeza mumaliriza ddi?
Tumaliza mu August nga 3 omwaka guno. So July wagwerako bwati tugenda kuba
mukola omwaka gumu.
Tukola omwaka gumu medical internship nenga tulizo nsasula buli mwezi.
Kakati waliyo abajja?
Kati waliyo n'abajja.
Balinga bameka?
Wakati era bajja kubeera mu figures eziri awo ng'e2,000. Bajja kubeera nga mu 2,000. Kuba kati ezo figure ebeera etuyamba. Ezo 2,000 bwe zitawera amalwaliro agamu gayinza okufuna ba medical intern abatamala. Weba nyinza okuba ku kifaananyi ekiri wansi eyo mu malwaliro. Wakati tuyinza obutabeera amalwaliro ffe kumanya kigenda mu maaso. Nze mbeerayo. Mu ddwaliro tugenda tukekiseera ng'omuntu oli omu olina okukola ku balwadde 2. Naye ng'ekyo kintu oli medical intern mukama wa kutumye agambye nti genda okole ki okole ku ward yagira awummulamu oba akola emirimu gy'emirala obeerawo n'okola
kozesa ekigambo oba okuba nti oli medical intern oba junior doctor eyo lyakitegeeza
nti oyo junior doctor oli musawo omuto
oba toyiga buyizi oba omanyi kyokola
naye ate ekyenjawulo kiri nti engeri kiri nti gwe oli asookerwako gwe oli mu kuyi nkiyite ntya wabeerawo bano ab'amagye abasooka abakwata emmundu nga yakayingira amagye nga tanafuna ranka nga tafunafuna mayinja abo abawansi balina engeri gye babayita ne mu poliisi be bakola gino emirimu egya wansi be bagenda ku front line be bakwata emigugu be bakuuma abakulu kati ffe abo abaki ab'amagye mu luno olutalo ffe ba front line soldier ffe abaddugala babakwata mu musaayi ffe abasookawo era omulwadde wabaze na covid era nze agenda osooka okola okumufuna mukama wange ngenda omukubira esimu ngamba ano omulwadde alina ebola mukama wange ajja yeetegese ye
era mwe mwafunamu abalwadde abaafuna obuzibu mu covid
era ffe abafuna abasawo baali bafuna obuzibu ffe abafuna abasawo bafuna obuzibu mu covid ffe abafuna abasawo balwala ku ebola nozolaba ekifaananyi ekyo so ffe abawansi ngeri kinti ffe abawansi tukola gino emirimu gyonna emingi okeera ku makya ku ssaawa 2 noyingira eddwaliro n'otandika mulwadde kige baleese kola
ekituzibuwalira okutegeera n'abalabi nti bakama bammwe baaliko we muli
kituufu nnyo bakama baffe
lwaki kirabikanga ani atategeera munne mwe mutabategeera be batabategeera
abantu balimu kyenaliisa obuyaayi abantu wabeera eno mu ntebe yo wabanga agirimu nga kutona giyigiramu abeera agamba ebintu si birungi katulabe batwongere ku ssente naye ate bwakyusaamu nadde eri ku basalawo eri mu gavumenti oba okubeera ng'afuuse omukulu ate yerabira nti eno gye yava naye beetaaga okubeera nga bakola ki nga balina smooth ride nga nabo bayitayo bulungi abaliyo okiraba mu kwerabira okwo kwe kujja okujjawo bino ebintu ebirungi ebyo yayitamu abaliyo ate bo bayite muki mu kubonaabona ndowooza okiraba wakati medical intern kati omuntu intern nurse kangamba alina abalwadde 5 ku ward bonna alina okubakuba empiso abawa eddagala bonna alina okubeera ng'akola ki alina okubeera nga kangamba abateekamu n'egituba abaliisa alina obbalongoosa kuliko baana abalwadde bambi bamuleeta nga poliisi yemuleese nga bambi mulwadde wa bwongo bamukoonye tategeera tetumanyi namannya tetumanyi nawe baabwe gye bali tetunanga akasimu ke naye nansi ono n'asalawo n'agaba bambi kamulongoose yeyononedde omusaayi ogumuliko biki ebyo byonna n'akola ku balwadde abalala 4 kangambe banansi abo bali 2 emirimu egyo n'agikola naye ate mukama we najja n'amubuuza nti bambi emirimu wagikoze bulungi nga gayagala okubuuza amaladdeyo yawummule tekiba kirungi kati twali tugamba nti bambi ono omuntu okumwewaza okubeera nga anoonya emirimu emirala okumwewaza okubeera nga agezaako okubeera nga afuna akasente akalala kayinza okumuyamba n'okumala ebizibu bye musasula akasente kasaana okubeera nga afuna omwerabiza ebizibu by'okunoonya ssente afokasinge mu kubeera nga ajjanjaba ki ajjanjaba abalwadde.
Dr. Rama, ekitongole kya Uganda Medical Association ekitwala abasawo bonna kikulemberwa Dr. Luswata Herbert kyogera ki ku nsonga eyo mwakitegezezaako?
Twakitegezezaako
ekitwala aba pharmacist ekitongole kitwala abalongoosa ab'amannyo Uganda Dental mwabitegezezaako ebyo?
Yes, twabategezeza bonna tetusobola kugenda mu eno nsonga nga tetutegezeza ku bakama baffe. Omanyi kiina emiti na kiina levels nti kati ate nno bwe tuba tugenda okubeera nga tukola strike eno tekitegeeza nti ate twagala abantu baffe nedda twagala tukendeeze ku maanyi gano agaffe ge tuli mu kuteekamu tujjukize bano abantu abali mu gavumenti nti abaayi ffe tukola emirimu mingi okubeera nga tukola ki tutuusa obulamu oba noki n'obujjanjabi eri omuntu wa wansi naye bwe tuba tubugjeeyo abantu abalala bagenda kuba bakola emirimu mingi kati kyetukola tugenda ne tuwandiika eri zino association zonna ezitukulembera zibeere nga nazo number 1 ziteekamu eddoboozi lyazo kuba zitusinga eddoboozi ziteekamu eddoboozi lyazo okubeera nga lituuka eri ewala abantu basobole okubeera nga bamanya nti webanga uma naye ekwatiddeko kiba kitegeeza ensonga bano abaana gye balina ntuufu ate enkulu bano abasawo abato bano ba PSU ba Pharmacist Society of Uganda nawe baba batongereko eddoboozi kitegeeza nti bambi bano abasajja we baba nga abakulu baabwe bali mu kumanya nti eno ensonga balina okusasula ssente zino kiba kitegeeza nsonga nkulu ate nga gavumenti gyesibe basinga okuwuliriza ate n'ekyokubiri bwe tuba nga tujjeeyo buno obujjanjabi bwe tuba tuli mu kuwa zino association zirina okubeera nga zigattawo zino kubanga zigira abasawo baleera bali mu kuwumula bakama baffe bambi mutusonyiwe mubadde okuva we twatandika okukola mubadde mubadde mutulekedde emirimu egisinga mubadde muzeeyo ku mirimu gyammwe emirala naye kati engeri gyekindi tugenda kuteeka wansi ebikolwa mutere mujje mukwate ebikolwa mmwe bwe muba munaasobola mujje mujja abaladaawo bonna bali mutukolaki mubadde mutulekedde okiraba bwe muba kinaabajjukiza okubeera nga mukirowoozaamu nti nokusasula sente eziteekerwa okubeera nga tusasula mugenda kuddayo mugambe namwe bakama bammwe mugambe buli omu asobola okubeera nga mwongezeko namwe eddoboozi babeere nga basasula sente zetubeera nga tusaana okubeera nga tusasula ate ekinaavaamu okubeera nga tukomawo okubeera nga tukola ate buli kimu kibeere nga kitambula ki engeri kino okubeera nga kitambulizibwa.
Dr. Rama, luli mwe mwali mugenda mukwekalakaasa muyina be mwalekawo leero mugenda munaavaawo mugenda kuvaawo buvi bwe mutyo oba waliwo abagenda okusigalawo ekibinja ekimu nga kikola mu
ddakiika emu njagala kubeera nga ntegeeza abantu ensalawo eyaliwo eyaki eyaba medical intern ku lunaku lwe twayogera twalinayo ka meeting ka online 17th January of 2024 twatwalanye tusalawo nti tugenda kussa wansi ebikolwa at all levels. So tugenda kussa wansi ebikolwa ku level zonna nti wadde emergency abakulu bajje bakole ki bakole kuba basasula government newankubadde batono bajje bakole kuba kati kirabika engeri ki nti embeera eri nti ffe medical intern tebali kutubalamu nti tukola omulimu gw'amaanyi ffe katuse wansi ebikolwa bo bajje bakole then we banaabalaba kibagezeeko ensonga bazikwasaganye then ffe tukomewo tukole ki fenno by the way tuli ready, we are always ready. Nze nno obudde bwonna bwempitibwa omulwadde oba bwempitibwa mukama wange okubeera nga ntuusa obujjanjabi eri omulwadde mbeerawo full time ffe tubeerawo 24/7 tuli bajasi baku ttaka tulya tukola emirimu tetuzikiza ne batuyita naye sente zikoze eki zigenda kusasulwa tuba twakomyewo dda nga twatabisedde okukola.
Abatulaba mwe bali kutwegattako erinnya lyange Kintu Mutesaasira Senior mbadde ne Dr. Rama Musiho ate nga ye site officer wali ku Mulago National Referral Hospital nga tukubaganya ku ebirowoozo ku nsonga za ba junior doctors bayite ba medical interns okwekalakaasa kwabo okutandika ng'ennaku z'omwezi lumu omwezi ogwokubiri gwe mwezi ogujja ye wiiki ejja olw'ensonga z'ebyemisaala egikutte wansi ne waggulu. Kino nno kyayogerwako ebbanga ddene naye tujja kwogera ebisingakaawo mwe bali kutulaba Dr. we bali kujja sebo.
Amen.
Kale mukama abakuume mubeere bulungi mweraba.
Focus on healthy morning. Bethany TV for health. Showing on Bethany TV. Life-threatening experiences. More